Hello, my name's Leonie Short, and I'm a registered dental practitioner, a dental therapist. And I used to call myself the tooth fairy, but now that I'm getting older, I think it's more appropriate if I call myself the fairy godmother. I started working as a dental therapist, a school dental therapist in rural New South Wales. And then with some further study, I actually expanded my work into being an academic and researcher. And over the years, I've ended up working at 6 different universities in New South Wales and Queensland. I also had a period of about 3 years where I worked in the community sector, and I really liked that. And I've also been appointed to boards, whether they be in Queensland or nationally. I've had a very consumer focus to my work and to my board work. And I've been a consumer advocate in the fields of breast cancer, colorectal cancer, substance abuse and oral health. And now I'm concentrating more on the oral health part. Last year, I established my own company, Seniors Dental Care Australia, and I'm focusing on training or oral healthcare training and education for health workers in the aged, home and disability sectors. And that's the whole range of health workers, from carers, enrolled nurses, registered nurses, allied health practitioners and general practitioners, medical practitioners, in how to recognise and improve oral health care. And it's something that I'm really passionate about, and I see it as a real gap in the market. Seniors Dental Care Australia provides oral health care training and education for health workers in the aged, home and disability sectors. And we can either do that on site, and last year we did some training on site, and we actually did it at the 3 different shifts, so morning, afternoon and evening shifts. So we were there from, say, 8 p.m. to midnight, or there from 9 a.m. to midday. We're very flexible in how we do that training. We can also do it online via video or online electronic resources. So there's a whole range of ways that we can deliver that training. But I must say, when you do it on site, the carers are really engaged. They really like it, and they feel so much more confident and better about it when they're more knowledgeable and better at the skills. We actually do hands-on skills training, and so we see a great improvement in how the oral health care is delivered, and also more referrals when appropriate for oral health care. When I go into aged care homes, and I've been doing it over the last 8 years, it's really sad for me because I see people with smelly mouths, rotting teeth, infected gums and dirty dentures. And that's not what anybody wants. We actually want people to have nice, healthy, clean mouths, and we want them to be able to smile, to talk, to taste and to eat. And the ramifications, if the person doesn't have that clean mouth, we are looking at aspiration pneumonia and infective endocarditis. So poor oral health can lead to hospitalisation and, sadly, death. We also, this is from the United Kingdom, there was a case of a resident who died, and when they did the autopsy, they found that dentures were lodged in her throat. And at the time when she was sick, the GP wouldn't look in her mouth because she had COVID. And so nobody looked, nobody knew, and it was from ill-fitting dentures being swallowed and the person choking and dying. So those are terrible adverse effects. That's the only one I know of, but it can happen. So we're really looking at, apart from the poor quality of life of somebody with a dirty mouth, we are looking at hospitalisations and deaths from either diseases or accidents. From the years I've been in the consumer health movement, I really am coming from the patient experience. I'm really hoping that patients and residents, I should say, like my mum was in dementia care for 5.5 years. I want her and others to live their life to their full potential, to be well cared for, and to be happy. And so from that patient experience, I want them to have improved oral health experiences and outcomes. And from my point of view, I don't think it's much to ask for, but we have to really work hard to make it happen. And we need a lot of people to help us do that.